Our United Kingdom is in the midst of the fastest growth in COVID cases that we've ever known. Previous waves of the pandemic didn't have a single day with more than 100,000 new cases reported. One day last week, we had 200,000 people test positive, and the latest figure today is another 218,000, though that includes some delayed reports. So anyone who thinks our battle with COVID is over, I'm afraid, is profoundly wrong. This is a moment for the utmost caution. But our position today differs from previous waves in two crucial respects. First, we now know that Omicron is milder than previous variants, so while hospital admissions are rising quickly, with over 15,000 COVID patients now in hospital in England alone, this is not yet, thankfully, translating into the same numbers needing intensive care that we saw in previous waves. Second, thanks to the fantastic national effort to get Britain boosted, we now have a substantial level of protection, higher than any of our European neighbours, with over 34 million boosters administered, including in England, reaching more than 90% of the over 70s and 86% of the over 50s. And so, together with the Plan B measures that we introduced before Christmas, we have a chance to ride out this Omicron wave without shutting down our country once again. We can keep our schools and our businesses open, and we can find a way to live with this virus. But the weeks ahead are going to be challenging, both here in the UK and across the world. There is no escaping the fact that some services will be disrupted by staff absences. But we've been working through Christmas to prepare for this wherever possible. And if we all play our part in containing the spread of this virus, the disruptions we face can be far less severe than a national lockdown, with all the devastation that would bring for the livelihoods and the life chances of our children. So, the government is acting to protect critical national services, to keep supply chains open, and fortify our NHS to withstand the pressures ahead. We've identified 100,000 critical workers in areas from food processing to transport to our border force, and from the 10th of January, we'll be rolling out lateral flow testing for all these workers, available on every working day. We'll be sending testing kits directly to these organisations and liaising with them on the logistics. We've asked qualified teachers who have left the profession to come back and help fill temporary absences, and I want to thank them and all teachers, parents and pupils for taking the precaution to test yourselves and to wear a mask in the classroom, enabling vital face-to-face education to continue. We're increasing NHS capacity by building on-site Nightingale hospitals, as well as creating 2,500 virtual beds where people can be safely treated at home. We've bought more antivirals per person than anywhere else in Europe. Those are the tablets which reduce your chances of going to hospital once you've caught COVID.